They're people who she's working with today, and they are called um, a treatment, ultra treatment non-responders. So they've had other antipsychotics, they've had different kinds of medications, they've had clozapine, and they failed that. They've had maybe electroconvulsive therapy, they failed that. And what she has done, and other neuroscientists, researchers, and epilepsy neurology experts have done, is they were able to map the different regions of the brain, and our brain has a lot of little sections in it, like organs of our body, like the heart and the liver, or different parts of our brain. They were able to map them and then put, believe it or not, electrodes, so electrical wires that are about the size of a hair, so really, really thin wires, into particular sections of the brain. And then they have a little cable coming out the back of the neck, and then it's implanted in their chest, so they can plug in a stimulator and then send an electric current into parts of their brain. And they were able to reduce for maybe 5 days, 7 days, the hallucinations and the delusional stuff, particularly hallucinations of the person with schizophrenia, by stimulating the brain for a few minutes at certain wavelengths and certain frequencies of electrical power. Again, that electricity thing. And then the symptoms go away for a while. Then they come back and they get in a little treatment. And so it's a fascinating thing. And the three people had the electrodes put in slightly different parts of their brain. Yeah. And it was just a fascinating bit of research. Actually, this doctor in Dallas, she has 3 patients. So next step, working with the neurologists who have already pioneered this electrical stimulation for people with epilepsy, is to continue to do that work, to expand it, to get more humans being tested, and then to see if they can extend the length of effectiveness from just a few days or a week to longer periods of time. And then what's going to be the ability to maybe replace the electrodes in their brain, so they have to put a hole in the skull and put this wire in and connect it to the output. So it's a really complicated thing, and there's lots of human use studies. It turns out she and I, after the meeting, after her presentation, we talked about something called microdialysis.